Kelly, Martin, and her husband, Dawn, were taking Christmas decorations down from the attic of their suburban Garland, Texas, home in November 2011 when Kelly missed a step on a ladder and fell. Her family doctor ordered an X-ray and diagnosed a herniated disc in her back. He gave the Martins a card for a neurosurgeon who was then establishing himself in the area, Dr. Christopher Duntsch. The couple met with Duntsch, who confidently explained that minor routine surgery would fix it for good. Because Kelly, 54, was an elementary school teacher who hoped to be healed in time for a summer Caribbean cruise.
It was explained to us like a very routine surgery, almost like kind of getting a cavity done. You know, this is something that just needs to be done and you're going to be fine.
Kelly even asked Dr. Duntsch, have you ever had any bad outcomes or deaths in your surgeries? And he said no, knock on wood.
The surgery was scheduled for her March 2012 spring break. But as Don sat at the hospital, expecting to take his wife home after recovery from what Duntsch had said would be a 45-minute procedure, his wait stretched to hours. Duntsch emerged to say there'd been complications. Is she going to be okay? A worried Don asked. Yes, Duntsch said. Duntsch cut through her spinal cord and severed an artery. Duntsch continued operating despite clear signs that Martin was losing massive amounts of blood. He refused to abort the surgery even after a trauma surgeon colleague and an anesthesiologist warned him about the blood loss. He refused to acknowledge anything was wrong, hindering the ICU team's efforts to save her. When Martin awoke from anesthesia, she was screaming and clawing at her legs, forcing the ICU team to re-anesthetize her. Duntsch also stayed out in the ICU waiting room writing notes rather than attending his patient, even after Martin went into hemorrhagic cardiac arrest. Martin ultimately bled to death.
Dr. Duntsch never said a word and kind of looked down at the floor, not even giving us eye contact.
But to understand what led to Kelly's tragic death, we must look deeper in Christopher Duntsch. Christopher Duntsch was born in Montana and spent most of his youth in Memphis, Tennessee. His father, Donald, was a physical therapist and Christian missionary, and his mother, Susan, was a school teacher. He is a graduate of Evangelical Christian School in the Cordova suburb of Memphis, where he was a star football player. Duntsch initially attended Millsaps College to play Division I college football and later transferred to Division I Colorado State University. Former teammates later said that, while Duntsch trained hard, he lacked talent at the game. Duntsch returned home to attend Memphis State University, now the University of Memphis. Duntsch decided to switch to a career in medicine. He completed his undergraduate degree in 1995, then continued on to an ambitious MD-PhD program. In 2010, he completed the MD-PhD and neurosurgery residency programs at the University of Tennessee Health Science Center, and subsequently completed a spine fellowship program at the Semes Murphy Clinic in Memphis. Duntsch completed his residency having participated in fewer than 100 surgeries. Typically, neurosurgery residents participate in over 1,000 surgeries in the course of their residency. He was suspected of being under the influence of cocaine and LSD while operating during his 4th year of residency training, and was sent to a program for impaired physicians. He remained there for several months before being allowed to return to the residency. Several of his friends recalled him going to work after a night of doing drugs, with one of them saying he would never allow Duntsch to operate on him. While in Memphis, Duntsch frequented strip clubs. He had come to the attention of Wendy Renee Young when she was an exotic dancer at one club. In 2011, she approached him at a different club she was stripping at after she noticed that all the girls were over there, making her aware that he was a doctor and that, of course, that's where you're going to go for money. She immediately moved in with him, and they went on to have 2 sons together, though they had broken up by some time just prior to the birth of their second son in September 2014. He looked extremely qualified on paper. He had spent a total of 15 years in training medical school, residency and fellowship, and his curriculum vitae was 12 single-spaced pages. Duntsch also claimed to have graduated magna cum laude from St. Jude Children's Research Hospital with a doctorate in microbiology, a program that the hospital did not offer at the time he allegedly attended. Duntsch's first job as a practicing physician was at the minimally invasive Spine Institute in the affluent Dallas suburb of Plano, which hired him in the summer of 2011, when he also received privileges to operate at Baylor Regional Medical Center. The hospital welcomed Duntsch with a $600,000 advance. While no one from the practice agreed to be interviewed, they sent an email describing the recommendations they had gotten from Duntsch's supervisors at the University of Tennessee Medical School in Memphis. Duntsch was one of the best and smartest neurosurgeons we ever trained. In 2010, Boop faxed a recommendation for Duntsch to Baylor Plano, checking off good or excellent in boxes, asking about his skills and noting, "Chris is extremely bright and possibly the hardest working person I have ever met." Another supervisor, Dr. John Robertson, who was an old family friend of the Duntsches and an investor in dysgenics, noted on his recommendation that Duntsch had an excellent work ethic. A vascular surgeon who operated at Baylor Plano, Dr. Randall Kirby, said he met Duntsch soon after he started and found him to be an arrogant know-it-all. "I would see him maybe once a week at the scrub sinks or in the doctor's lounge," Kirby said. "He is among giants up there, and he was trying to tell me over and over again how most of the spine surgery here in Dallas was being done inappropriately and that he was going to clean this town up."
Down to Dallas to clean everything up because most of the work here was being done wrong. These were extraordinary statements coming out of the mouth of someone that just got finished training. I'd never heard anyone talk like that in my entire career.
Lasted only a few months at the Spine Institute, not because his patients had complications, but because of a falling out with the other doctors over whether he was fulfilling his obligations. One weekend in September 2011, Duntsch was supposed to be taking care of a patient after performing operation, but he went to Las Vegas instead. In December 2011, Duntsch sent an alarming email to Kimberly Morgan, his surgical assistant and ex-girlfriend. "Unfortunately, you cannot understand that I really am building an empire. Anyone close to me thinks that I likely am something between God, Einstein, and the Antichrist. What I am being is what I am, one of kind, a stone-cold killer." Nonetheless, Duntsch still had privileges at Baylor Plano, and on December 30, 2011, he operated on a man named Lee Passmore. At the time, Passmore was an investigator in the Collin County Medical Examiner's office, just north of Dallas. He had undergone successful back surgery once before, but the pain had returned. Passmore's pain specialist told him he didn't have a back surgeon to whom he routinely referred patients, but that he'd gone to lunch recently with one who seemed like a guy that knew what he was talking about. Vascular surgeon Mark Hoyle assisted with the operation. He watched in alarm as Duntsch began to cut out a ligament around the spinal cord. Passmore started bleeding profusely, so much so that the operating field was submerged in a lake of red. Duntsch not only misplaced hardware in Passmore's spine, but he stripped the screw so it could not be moved. Hoyle either grabbed Duntsch's scalpel or blocked the incision. He could not remember which, to keep Duntsch from continuing the procedure. Then Hoyle said he left the operating room and vowed never to work with Duntsch again. Passmore lives with chronic pain and has trouble walking as a result of Duntsch's errors.
Who was working with Dr. Duntsch for the very first time, became so alarmed at what Dr. Duntsch was doing that he physically stopped the surgery, grabbed the tools, put his hands over the surgical site, and demanded that Dr. Duntsch stop. He said, "You're dangerous. I'm never working with you again."
The next patient Duntsch operated on was Barry Morguloff. Morguloff ran a pool service company. He had worn out his back working in his father's import business, helping to unload trucks. His pain returned after an earlier back surgery, but the surgeon recommended exercise and weight loss, not another procedure. A pain specialist gave Morguloff Duntsch's card. His surgery, an anterior lumbar spinal fusion, took place on Jan 11, 2012. At the request of a head and neck surgeon also on the case, the vascular surgeon assisting Duntsch was Kirby. Kirby said it should have been a routine case, but Duntsch quickly got into trouble. Instead of using a scalpel, he tried to pull Morguloff's problem disc out with a grabbing instrument that could damage the spine. Kirby said he argued with Duntsch, even offering to take over, but Duntsch insisted he knew what he was doing. Kirby left the room. Morguloff awoke in excruciating pain. The procedure had left bone fragments in Morgulov's spinal canal. Later, he underwent a repairing surgery with another surgeon, but Morgulov still walks with a cane. As scar tissue builds up, his pain will worsen and his range of motion will decrease. One day, he will likely be in a wheelchair. Soon after the Morgulov surgery, Duntsch took on a patient who was also an old friend. Jerry Summers had played football with Duntsch in high school and helped with logistics at the research lab during his residency. When Duntsch took the job in Dallas, he asked Summers to move with him and help set up his practice. They lived in a downtown luxury high-rise while Duntsch shopped for a house. Summers said he asked Duntsch to operate on him because he had chronic pain from a high school football injury that had gotten worse after a car accident. After the February 2012 surgery, however, Summers couldn't move from the neck down. Duntsch had damaged Summers' vertebral artery, causing it to bleed almost uncontrollably. To stop the bleeding, Duntsch packed the space with so much anticoagulant that it squeezed Summers' spine. For days after the operation, Summers lay in the ICU, descending into a deep depression. Jerry was calm with Chris, said Jennifer Miller, then Summers' girlfriend, but all Jerry would say to me is, "I want to die. Kill me. Kill me. I want to die."
First thing I remember is not being able to move, and I just was kind of freaking out. Just feels like your body weighs about 10,000 pounds and you can't pick it up. And
could you move anything?
my head.
One morning, Summers began screaming and told several nurses that he and Duntsch had stayed up the night before the surgery doing 8 balls of cocaine. Baylor officials took Summers' accusations seriously and ordered Duntsch to take a drug test. As at the University of Tennessee, he stalled at first, telling administrators he got lost on the way to the lab. He passed a separate psychological evaluation and, after 3 weeks, was allowed to operate again. But he was told to stick to relatively minor procedures. In his 2017 deposition, Summers acknowledged he made up the pre-surgery cocaine binge because he felt Duntsch had abandoned him as both his surgeon and his friend. "I was just really mad and hollering and wanting him to be there," Summers said, "and so I made a statement that was not something that was necessarily true. The statement was only made so that he might hear it and go, 'Let me get my ass down there.'" His first patient after his return was elementary school teacher Kelly Martin, who bled to death during operation. Baylor Plano again ordered Duntsch to take a drug test. The first screening came back diluted with tap water, but a second, taken a few days later, came up clean. Hospital administrators also organized a comprehensive review of Duntsch's cases, after which they determined that his days at the facility were over. But importantly, they did not fire him outright. Instead, he resigned, leaving on April 20, 2012, with a lawyer-negotiated letter saying, "All areas of concern with regard to Christopher D. Duntsch have been closed. As of this date, there have been no summary or administrative restrictions or suspension of Duntsch's medical staff, membership or clinical privileges during the time he has practiced at Baylor Regional Medical Center at Plano." Since Duntsch's departure was technically voluntary and his leave had been for less than 31 days, Baylor Plano was under no obligation to report him to the National Practitioner Databank. The databank, which was established in 1990, tracks malpractice payouts and adverse actions taken against doctors, such as being fired, barred from Medicare, handed a long suspension, or having a license suspended or revoked. The information isn't available to the public or other doctors, but hospital administrators have access to the databank and are supposed to use it to make sure problem doctors can't shed their pasts by moving from state to state or hospital to hospital. Many hospitals, however, hesitate to submit reports to the databank, worrying that doing so may hurt doctors' job prospects or even prompt lawsuits. Despite his string of problems at Baylor Plano, Duntsch also wasn't reported to the Texas Medical Board, the state's main purveyor of doctor discipline. Such boards often move slowly, but if hospital officials submit material they've gathered to justify letting a doctor go, boards can act to protect patients from imminent harm. Duntz's next stop was Dallas Medical Center, which sits outside Dallas's northern edge in the city of Farmers Branch. Baylor Plano officials might have thought any future employer would contact them before hiring him, and they could share information confidentially. But Dallas Medical Center granted Duntsch temporary privileges, while its reference checks were still going on. On July 24, 2012, Duntsch operated on Flola Brown, 64, a banker about to retire after a long career. She had come to Duntsch for cervical spine surgery to ease her worsening neck and shoulder pain. About a half hour into Brown's surgery, Duntsch started to complain that he was having trouble seeing her spine. He was saying, "There's so much blood I can't see." "I can't see this," said Kyle Kissinger, an operating room nurse. He kept telling the scrub tech, suck more, get that blood out of there." "I can't see. That's really concerning to me because not only that he can't do it correctly when he can't see that, but why is it still bleeding?" Brown bled so much that blood was saturating the blue draping around her body and dripping onto the floor. The nursing staff put down towels to soak it up. After the operation, Brown woke up and seemed fine, but early the next morning she lost consciousness. Pressure was building inside her brain for reasons that were unclear at the time. That same morning, with Brown still in the ICU, Duntsch took another patient into surgery. The patient's name was Mary Eford. She was an active 71-year-old who'd sought Duntsch's help because back pain was keeping her off her treadmill. Duntsch arrived at the hospital about 45 minutes after Eford's surgery had been set to start, Kissinger said. He spotted a hole in Duntsch's scrubs. It's on the butt cheek of his scrubs. He didn't wear underwear. That's why it really shined down to me, Kissinger said. The nurse realized he'd seen that hole for 3 straight days. Duntsch apparently hadn't changed his scrubs all week. Kissinger also noticed that Duntsch had pinpoint pupils and hardly seemed to blink. When Duntsch arrived, the staff told him that Brown, his patient from the day before, was in critical condition. Soon after beginning Eford's surgery, Duntsch turned to Kissinger and told him to let the front desk know he would be performing a procedure on Brown called a craniotomy, cutting a hole in her skull to relieve the pressure in her brain. Problem was, Dallas Medical Center did not perform those, or even have the proper equipment to do them. In the end, Duntsch did not perform a craniotomy on Brown. She was moved to another hospital but never regained consciousness. Her family said they withdrew life support a few days later. A neurosurgeon hired to review her case would later determine that Duntsch had both pierced and blocked a vertebral artery with a misplaced screw. The review also found that Duntsch misdiagnosed the source of her pain and was operating in the wrong place. The day after her surgery, Eford awoke in agony. She couldn't turn over or wiggle her toes. Hospital administrators called Dr. Robert Henderson, a Dallas spine surgeon, to try to repair the damage. Shortly after he arrived at the hospital, Henderson pulled up Eford's post-operative x-rays. When he saw them, he said, "I'm really thinking that some kind of travesty occurred." That impression only grew when Henderson reopened Eford's freshly made incisions the next day. It was as if he knew everything to do, Henderson said of Duntsch, and then he'd done virtually everything. There were 3 holes poked into Eford's spinal column, where Duntsch had tried and failed to insert screws. One screw was jabbed directly into her spinal canal. That same screw had also skewered the nerves that control one leg and the bladder. Henderson cleaned out bone fragments. Then he discovered that one of Eford's nerve roots, the bundle of nerves coming out of the spine, was completely gone. For some inexplicable reason, Duntsch had amputated it. The operation was so botched, Henderson recalled thinking Duntsch had to be an imposter passing himself off as a surgeon. Even after Henderson's repairs, Eford never regained her mobility and now uses a wheelchair. By the end of the week, hospital's administrators told Duntsch he would no longer operate at Dallas Medical Center. After Duntsch's disastrous run at Dallas Medical Center, he was finally reported to the state medical board. The first report came from Shulkin, the Dallas physician who served on the board, who had been told of the surgeries on Eford and Brown. Other doctors started complaining too. Once I heard about those cases, I called the medical board, said Kirby, the vascular surgeon who had been present for Morgulov's surgery. I said, "Listen, we've had egregious results at Baylor Plano. He was not reported to the databank. We've had egregious results at Dallas Medical Center. He's got to be stopped." after being called in to help Eford, Henderson too, made it his personal mission to stop Duntsch from operating. He called Boop at the University of Tennessee to ask about Duntsch's training and spoke to officials at Baylor Plano Hospital. He also called the state medical board. When a couple of months passed and they didn't hear about more bad outcomes, Henderson and Kirby said they assumed perhaps Duntsch's mistakes had finally caught up with him. Then, in December 2012, Kirby was asked to help Jacqueline Troy, a patient suffering from a severe infection. Troy was being transferred to a Dallas hospital from a surgery center in the suburb of Frisco. She'd had neck surgery, but the surgeon had cut her vocal cords and one of her arteries. When Kirby learned the details, he asked the doctor who referred the case to him about the surgeon. Is it a guy named Christopher Duntsch?
They didn't know if I would survive.
Soon after Troy's surgery, Duntsch was finally reported to the National Practitioner Databank, though not by any of his previous employers. A report dated January 15, 2013, obtained by an attorney representing one of Duntsch's patients, shows that Methodist Hospital in the Dallas suburb of McKinney had reported Duntsch after denying him privileges 6 months earlier. Their rejection was based on Duntsch's substandard or inadequate care at Baylor Plano. But even after the report to the databank, Kirby was stunned to discover another hospital had given privileges to Duntsch. In May 2013, he was invited to a Meet Our New Specialist dinner thrown by University General Hospital at a Dallas restaurant. The event was to celebrate the arrival of a new neurosurgeon, a Christopher Duntsch. University General, formerly known as Southampton Community Hospital, had a troubled history. 2 bankruptcies and a former CEO sentenced to prison for healthcare fraud, purchased for $30 million in 2012 by a Houston-based company. University General was one of only 3 hospitals serving Dallas's southern half, an area that spans 200 square miles and includes more than 560,000 people. The surrounding community was hoping for a turnaround. The hospital is now closed, and its administrators from that time did not respond to questions about why they hired Duntsch. It likely came down to simple economics. According to the healthcare analysis firm Merritt Hawkins, the average neurosurgeon is worth $2.4 million a year in revenue to a hospital. It was at University General that Glidewell had his neck surgery, knowing none of Duntsch's by then 2-year history of botching operations. Glidewell's back problems had begun almost a decade earlier, in 2004, when he broke his back in 2 places in a motorcycle accident. After a year of rehab, he tried to go back to his job working on air conditioning systems, but lasted only months before the pain stopped him. He left his first meeting with Duntsch elated and filled with hope. Once at the hospital, Glidewell and his wife waited. 3 hours late, they said Duntsch finally arrived in a cab. He had on jeans that were frayed at the bottom, Glidewell said. He didn't look like he was ready for a surgery. Reluctantly, Glidewell went ahead. But hours later, Duntsch came out and told Glidewell's wife that he had found a tumor in Glidewell's neck and aborted the procedure. I was devastated, crying, Robin Glidewell recalled. She went to see her husband in the recovery room. Immediately, Jeff was. Where is the doctor? I can't move my arm or my leg. He was having trouble even talking and said, something's wrong, something's wrong. Duntsch mistook part of his neck muscle for a tumor and abandoned the operation midway through. After cutting into Glidewell's vocal cords, puncturing an artery, slicing a hole in his esophagus, stuffing a sponge into the wound, and then sewing Glidewell up, sponge and all, Glidewell spent 4 days in intensive care and endured months of rehabilitation for the wound to his esophagus. To this day, he can only eat food in small bites and has nerve damage. He still has numbness in his hand and in his arm, said his wife, Robin. He basically can't really feel things when he's holding them in his fingers.
This is almost literally a serial killer.
A serial killer? Do you think that's a fair and accurate description?
Oh, absolutely. That's how egregious the surgery was.
By the time Duntsch operated on Glidewell, the state medical board had been investigating him for about 10 months. Frustrated by the board's inaction, Henderson had called the lead investigator 6 months earlier to beg for faster intervention. In a recording Henderson made of the call, he says, "This is a bad guy, and he needs to be put on the fast track if there's such a thing." She tells him she wishes they could suspend his license while they investigate, but the board's attorneys wouldn't go for that. Kirby sent the board a 5-page letter on June 23, 2013, spurred by what had happened to Glidewell. "Let me be blunt," it said. "Christopher Duntsch, Texas Medical Board, license number 8183, is an impaired physician, a sociopath, and must be stopped from practicing medicine." On June 26, Duntsch was ordered to stop operating. The head of the medical board at the time, San Angelo family physician Dr. Irvin Zeitler, said the investigation took a while because it's not uncommon for there to be complications in neurosurgery. Kirby, Henderson, and another doctor decided to contact the district attorney, convinced that Dunst's malpractice was so egregious it was criminal. They met with an assistant DA but got little traction. The following spring, in March, police were called to a bank in northeast Dallas after passers-by noticed a man with blood on his hands and face beating on the doors. It was Duntsch babbling about his family being in danger. He was wearing the shirt of his black scrubs. It was covered in blood. Officers took him to a nearby psychiatric hospital. In April, Duntsch went to a Dallas Walmart because his father had wired him money. According to a police report, he filled a shopping cart with $887 worth of merchandise, including watches, sunglasses, silk neckties, computer equipment, a walkie-talkie, and bottle of Drakkar Noir cologne. He put them in bags he swiped from a register. He then picked out a pair of trousers and put them on in a dressing room. He put his own pants into the cart and rolled the cart out the front door without paying for the pants he was wearing. Moments later, he was arrested for shoplifting. Prosecutors began discussing the case and one assistant district attorney, Michelle Schuhart, found it particularly interesting. In 13 years with the Dallas DA's office, she'd prosecuted drug dealers, robbers, but never a doctor. "I went and started doing my own research," she said. "I just ended up taking over the case." As she and other prosecutors contacted every person Duntsch had ever operated on or their survivors, they struggled to figure what crimes he could be charged with. They settled on 5 counts of aggravated assault arising from his treatment of 4 patients, including Brown and Glidewell, and 1 count of injury to an elderly person because Efford was over 65. In Texas, this charge carried a potential life sentence. Duntsch was taken into custody on July 2015.
Hi Dad, this is Christopher. I was supposed to come home tonight, as you know, and I'm not now. Unexpectedly, the police came and picked me up regarding the DA issues that I mentioned to you. This is the phone of one of the detectives. If you would please call him back, he'll tell you what's going on. I had no idea what's going on with Bond and what's going to happen next, so I'll call you as soon as I can. Love you, thanks.
For some of his patients, the criminal case offered a last chance at justice they couldn't get through the civil courts. Since Texas capped damages in medical malpractice lawsuits, limiting the amount plaintiffs can be awarded for pain and suffering in most cases to $250,000, the number of suits filed and amounts paid out have plummeted. Ultimately, at least 19 of Duntsch's patients or their survivors obtained settlements, but 14 of them were represented by Van Way, who said she's taken them on more out of a sense of outrage than out of any financial upside. Morguloff was told no so often. He was surprised when attorney Mike Lyons finally took his case. He received a confidential settlement but said it wasn't much. He took more solace from the criminal case. To get this guy off the streets so nobody else got hurt again was important, he said. The public needed to know that there was a monster out there. Duntsch's trial began on Feb. 2017, and focused on the charge related to Efford, injuring an elderly person. The jury found Duntsch guilty of injury to an elderly person, Efford, and sentenced him to life in prison. Duntsch, who is now 50, is serving time in a Texas prison. He will be up for parole in 2045 when he is 74. Duntsch appealed his sentence and lost the appeal in 2018.